This is a picture of 16-year-old North Bay native Keera Daniel, who until just a few short months ago was living a very normal, happy, athletic life. The Chippewa student loved soccer, loved her friends, and loved her family. And through an unrelated trip to the hospital, discovered very quickly she had cancer in her left leg.
We were in North Bay then, and we had brought her up to the emergency department. She had fallen off her niece's bunk bed. And it was not too sore then, but 3 weeks later it was getting sorer, so we brought her to the emergency room. They figured it was an MCL tear, so we seen the orthopedic surgeon, Dr. Lewis, and we booked an MRI. But as time went on, it was getting worse and worse and worse.
An MRI in North Bay showed the worst possible case. Indeed, the youngster had cancer. That was on the 27th of January. 2 days later, she was flown to CHEO, the Children's Hospital of Eastern Ontario.
I don't understand what she's going and how she's feeling, but she also doesn't know how I'm feeling, so we come together as a team. We solve our little goals every step of the way, and we don't rush things anymore. It's one day at a time, and she controls it. It's how she feels and if she wants to talk. So it's a learning lesson to me too. I've never done this, so it's scary.
Step 1, chemotherapy. Plenty of chemotherapy, which of course can be very draining to the patient, especially one this young. Her doctor is one of the very best at CHEO, pediatric oncologist Dr. Ravina Rampal.
Osteosarcoma can be treated with a combination of chemotherapy and surgery. We start with chemotherapy, and the main reason for that is we want to shrink this tumor, which will allow surgery to, which helps with the surgery. And then the orthopedic surgeon, after about 12 weeks of chemotherapy, will go in and do a surgical procedure. There are different types of surgical procedures, and usually the orthopedic surgeon will discuss it with the patient and choose the best procedure for that patient.
No question, it's extremely tough for the patient to deal with cancer, very tough for the family to deal with cancer. How tough is it for the oncologist to deal with cancer, because they more or less become family to the patients themselves?
We cure about 75% of the patients that we see with childhood cancer. Then at the end of the day, I feel like I've done some good.
While Keera herself was not feeling good enough to do an on-camera interview on the day of our visit, two of her best friends came all the way from North Bay to stay overnight at CHEO to cheer Keera up and to talk about how they're coping with their best friend who's battling this deadly disease.
It's nice to see her in person and get to visit and talk, because it's different than on FaceTime. Like, as much as we get to FaceTime, it's just different in person. You get to play games and just create more memories. We talk about stuff going on in North Bay and then talk about stuff going on here, kind of just everything catching up.
It was pretty hard. At first, you don't really understand it completely, but then you keep going through it, and then.
Do these trips to Ottawa better benefit the patient or the friends?
Both. I think us being here helps out a lot.
Also helping out a lot, Keera's classmates back at Chippewa. They've already hosted one fundraiser, a very emotional fundraiser. More are on the way. There's also a GoFundMe page, as Keera had to leave 2 jobs in North Bay and has no benefits. Stepfather Gordon Stiller is back in North Bay, working trying to make ends meet. Meanwhile, in Ottawa, Keera just wants to hear the truth from the doctors as each day of Keera's treatment rolls on.
Give me the straight and we'll work through it. It's one day at a time. And I've come to, my favorite saying now is, cancer is a word, not a sentence.